use some of the extra funding to scrap hospital parking fees. Conservative MP Robert Halfon issued his call after the Prime Minister declined to add her voice to those demanding an end to the scandalous fees. The Daily Express is crusading to end rip-off parking charges which average £2 an hour and can reach £4 and which cost hospital patients, visitors and staff £174 million in England in 2016-17. Yesterday, after making a speech at a North London hospital on plans to deliver a £20 billion increase in NHS spending, Mrs May was asked by a journalist if she would scrap NHS car park charges. She responded, "Guidance has been issued to hospitals in relation to the use of car parking charges to make sure that that is appropriate and takes into account the particular needs of people, perhaps where people are in hospital for a significant period of time or people with certain conditions." Former Minister Mr Halfon, whose e-petition on the government website calling for an end to the stealth tax has already attracted thousands of signatures, said, "The Prime Minister is right to invest these extra billions in the NHS, but there should also be a dividend to bring an end to hospital car parking charges. These charges affect thousands of distressed patients and relatives, and hard-working NHS staff. Sadly, the guidance is not working." Nearly 50% of hospitals have increased their charges since the guidance was introduced in 2014. Almost the same number are charging disabled drivers. Parents are paying hundreds of pounds to get care for their children with cancer. The Prime Minister must make scrapping the fees a priority and bring an end to this stealth tax on the vulnerable, once and for all. The guidance introduced in 2014 suggested that hospitals offer free or discounted parking to staff, disability blue badge holders and people visiting gravely ill relatives. Since then, 47% of hospitals have increased their hourly parking charges and nearly half still charge blue badge holders.